Jodi Halpern is another person. I've collaborated with Jodi for many, many years for the Empathy Project. She is, I'm going to declare her, in my mind, the world's expert on empathy. She has been writing about it for 30 years or more. She's a deep thinker. She's incredibly emotionally intelligent. And go live up to that.
Well, I started 30 years ago when I was in kindergarten.
Tell them about yourself.
Yeah, I wasn't going to talk about myself, so now I figured out how to put it all together without any AI helping me. But you gave me a perfect segue because of how human the AI felt, and you used the word empathy. So I just want to say, because we were on other things today, in terms of AI in medicine, I just want to make a general statement that there's so many fantastic uses, and you're looking at two of the best people for that. Diagnostics, doing the science that will advance everything we can do to treat people, doing the medical records that burn all our providers out. So I'm very pro, and I co-founded a center at Berkeley, the Kavli Center for Ethics, Science, and the Public, where we look at AI, genome editing, and neurotech, and we developed the next generation of scientists and engineers to think about society. So I'm very pro science and technology in its rightful place. But I have studied, just like these folks love technology in a certain way, we talked about that, I love empathy. They're also very empathic, and I like technology. But so my career, I started out, I was in an MD, PhD program, getting a PhD in philosophy of mind and emotions. And
well, you can't just brush that off. The PhD in the philosophy of mind and emotion.
Well, I was the first person funded by the NIH to do a PhD in humanities or social science with an MD, and I was fully funded. I was a scholarship kid, and it was very exciting. But I was, thank you, thank you, first gen. But I was in the hospital, and I was on the wards going through the clerkships, you know, when you rotate as a med student, and an adult her mother was dying. So she was probably in her 40s, her mother probably in her 70s, and she was really felt sad losing her mother. And on rounds, I teared up, and I got in trouble for tearing up. And that started this huge passion. I mean, I was like 20. I went to school very early. This huge passion for figuring out whether empathy really mattered in medicine. Because I talked to these very smooth physicians who were I was at Yale Med School, and this very important leader there who everyone was very impressed by. And I said, well, you seem like you have a good bedside manner. You must have a lot of empathy. He said, are you kidding? I'm thinking about my golf game. You just fake it. And then everyone told me, if you feel things when you're with patients, you will burn out so quickly. So at 20, I decided that my career would be devoted to finding out if that was true, and specifically if cognitive empathy, we have two different parts of the brain, cognitive empathy and emotional empathy. They're studied completely separately to this day in psychology and neuroscience, and everyone thought you just need the cognitive type. But I thought you need both, and you need the cognitive type in a particular way, and I spent my early career proving it, and I won the PhD award for best PhD in any subject at Yale, and my book changed the field. Okay, are you happy?
Yes, now I'm happy. I'm everybody's mother here.
Well, I mean, I'm getting old enough that I might as well celebrate those things before I forget about them. But anyway, but what really we I came up with this concept of, which is very familiar now. But it used to be a term that was only associated with me. Now it's very broad, empathic curiosity. But it's a model that what we need, and I feel ridiculous. It's like me saying I discovered like cereal or something, because all of you know cereal. You all know empathic curiosity, which is you're listening to a friend or in your job, someone's talking to you, you're giving them, the person who does the bench, where's the great person? Say your name, stand up.
I'm Dixon.
Say the name of your project.
My project is called the Friendship Bench.
The Friendship Bench. They do this. They say you have to be fully present, right? And you have to be listening to someone, and two things are happening at once. And this is what we first we proved, and then neuroscience proved that it was true. We proved it conceptually first, that your emotions have to direct your cognition. It's like having a dream. If you have a scary dream, your emotions, like if you're having a scary dream, all the facts in your dream or your room or the hotel you're in or whatever, it all looks kind of sinister. And if you're having a sexy dream, it all looks kind of sexy and whatever. The point is your feeling states set the tone. They're like stage lighting for your cognition. This is what the model and it's all been proven. So that means that nonverbal attunement matters, okay? Cut to AI, and we'll have a lot to say about that. Just a few things that were not my work, but people who were part of research teams that I've collaborated with, but it was other people's brilliance to do all this. We now know in the doctor-patient relationship that empathy in this attuned way predicts the 3 most important parts of effective healthcare, okay? And I can give you all the studies later. Other people all over the world have done this. First most important part of healthcare is getting the diagnosis right. Patients, all of us, when we go talk to a doctor, we don't just tell them what we're most anxious about. If there's a new lump, if we've been drinking too much, if there's domestic violence, we don't bring it up. We say a little, we give a hint. And only if the doctor is non-verbally attuned do we disclose. And you can say the same thing, the doctor can say the right words, but only when they're non-verbally attuned do we disclose. That's how you don't miss things in the diagnosis. Second most important aspect of healthcare is effectiveness, effective treatment. As many of my colleagues here, I'm looking at James over there, many people know, half of healthcare is not effective because the patient throws the pills away or doesn't take them for long because of side effects. You know this so well, John. And so everything we're doing and spending money on in the health system, 50%, what is the predictor of adherence to treatment? Trusting your doctor. What's the predictor of trust? Does anybody know? Well, it's not directly empathy, but it relates. It's the perception that your doctor is genuinely worried about you when you're talking about something worrisome, that they're not faking it, the genuineness. Okay, third area of healthcare, dealing with difficult news and decision making, so cancer diagnosis, et cetera, and you have to make difficult treatment decisions and you're really upset and overwhelmed. That has been shown in nonverbal studies, that, in audio taped, year-long, you kind of wire up clinics for a year. The doctors and nurses and patients give permission, but then they kind of get used to it. Nonverbal attunement predicts the patient dealing with bad news afterwards by getting activated to make decisions about cancer treatment much more quickly, to seek treatment, and that can save lives. So medical effectiveness depends on full empathy.
Great.